Hi, everybody. This is Dr. Eliana Aaron. It's June 25th, 2020, and I'm going to answer some questions that I've gotten in the last week or so, so that everyone can get some answers. I hope I can answer them. Okay. So, first of all, question number one. Are you able to break down the age groups that are being most affected by COVID? Is there a significant amount of healthy people who are getting severely ill? We know the virus is dangerous for the elderly, of course. I've heard conflicting reports. I want to get EmaCare's take on it. There are people in the medical field who say it's not really a risk for younger, healthy people, and I want to know if that's accurate. And is there a difference between the Israeli and American virus? So there are actually like a bunch of little questions in here, and I'll try to get to them. So the first thing that I think we need to note is that I've been breaking down the numbers on a pretty regular basis. The wave that we're in right now is different than the first wave that we had. So are they part of the same wave officially? Yes, because it kind of went like that. But what we have is a situation where the first wave really did affect the elderly in a disproportionate way. There are less elderly that got sick, but much more that died. And we've been seeing that around the world. What we're seeing here is that the people who are getting sick, for the most part, are younger people. But what we've seen in the last few days is that the elderly are starting to get sick. It's starting to affect that population in a much bigger way. I showed a graph about this yesterday. The numbers have basically gone and doubled in the last couple of days. And that's obviously very concerning, even though the numbers are still small. It's something that we're very worried about. So we're keeping an eye on that. As far as, you know, are the people who are getting sick and dying, are they younger, are they older? When younger people die, they usually tell you about it. More specifically, there was a young man who died a few weeks ago. I discussed it in this group, and he didn't have any pre-existing conditions. He got sick with coronavirus a couple months ago. He ended up in the ICU for a month. He was considered recovered, didn't really recover. A lot of people, as I've also discussed, don't really recover. It just means they test negative, but he continued to suffer with symptoms and eventually died of those symptoms. So it is considered a coronavirus death, even though he officially tested negative. That's a case that shows that it does affect the elderly, and it does affect the young people. The question is, how is it affecting the young people? We know that there have been people who are young who have been intubated, who have been in critical care, and a lot of those people do not necessarily recover at the same rate as somebody who just has the flu. We're seeing that they have long-term disabilities, they have long-term breathing problems, there's a lot of scar tissue in their lungs. And the truth is that this is a new disease, and we don't have all the information that we need to make that determination as to whether or not the younger people are going to have an effect. What we do know also is that children, we've seen that children are developing Kawasaki disease, and they're dying of that. And that comes as a secondary result of the coronavirus. So I wouldn't say that it's prudent for any medical person to say that young people are fine and they can get it, no big deal, because we don't know that. That's not a factual statement. We do know that there are long-term side effects that young people are getting. By long-term, I mean, we're now at the end of June, and we know about this disease since December. And so that's the measurement. So we can't say long-term 3 years from now. But what we do know is that a lot of the conditions they have that we're familiar with, such as scarring and fibrosis of the lungs, are not things that go away. And they're not things that you could fully recover from. And a lot of people are reporting that when they recover, that, you know, young, healthy people, they can't climb a flight of stairs without being short of breath. They can't go back to exercising, and they're not returning to their normal lives. So I think that's very important. Is there a difference between the Israeli and the American virus? So when they do genotype, so they actually go in and look at the RNA of the virus, and they can tell what strand the virus is, what mutations it has. So 70% of Israeli cases have been the same strand as was found in the United States. So in theory, it's the same strain. In reality, there have been many mutations. I don't think that we have a recent count on how many mutations there have been, but this is a fast mutating virus. And the virus is going to adapt itself so it can survive, because viruses are very good at surviving. So my feeling is that it doesn't matter if it's the same virus. It matters what we do with it and how we prevent it from killing us. Next question. Looking at Norway, which is reopening without a problem, Israel's done the same shutdown on March 16th compared to Norway's March 12th. They started travel bans early, et cetera, et cetera. Norway did not have a policy of wearing masks. Any idea what makes them more successful when it appears that Israel may have stricter policies? So that's a really good question, and Norway is definitely one of the countries that I've been tracking. I don't bore everybody with every country I'm tracking because what can I tell you? Not everybody's interested in this, but Norway is an interesting case. The Nordic countries have done very well with the exception of Sweden. And a lot of that is cultural. It's important to understand that the Nordic countries are in a much more controlled society. You know, the government is much more involved in more aspects of people's lives, even though it is a democracy. They did do early measures. They do have a very high sense of social responsibility. It's part of their culture. And Norway also very quickly, probably faster than any other country, implemented financial measures to offset the losses that people had by having a lockdown. So that actually helped a lot. In Israel, that was quite delayed, and there are still a lot of areas and businesses that are not eligible to receive help with the restrictions in place. So that has obviously had an economic impact. As far as health impact, Norway has had a very controlled reopening of the economy. And frankly, Israel started off that way, but we did not continue in that pattern. So Norway, and this is from the Norwegian government health ministry website, when adjusting for measures of reopening, they have principles. And the priority is first given to children, and the second priority is then for people who are working. And that comes ahead of other measures. So their priorities are possibly a little bit different than our priorities. Their first priority is to collect information. So they're not going to implement any measures that they don't have enough information about in terms of being able to justify it through their own measurements and studies. And part of that is also like, do we really think people are going to do it? So that may answer some of the mask situation. You also have to realize that that Norwegians are not close talkers. They're not from like the Middle East. People talk right in your face like that, and that's just not the way they are. They practice social distancing in a different way than we do, because they don't normally have these like close encounters unless they're in a pub or something. The national regulations and the scaling down of these measures are done in a way that ensures proper infection control throughout. There's a lot of coordination between local governments, regional governments, and then the national government. And what we've seen in Israel is that the implementation of the regulations as we ease the general regulations has not really been well coordinated. The local authorities have not been involved. At the very beginning, the police had no idea what they were allowed or not allowed to do if people were violating quarantine, for example. So having all of those levels of authority and responsibility in place helps a lot to maintain the easing of the restrictions, and that's very coordinated in Norway. So the gradual and controlled approach to reopening is one of their principles also. So I'm going to actually read this to you because it's really important, and here's where you're going to see the difference between Norway and Israel. When one or more measures are scaled down, the effect on disease development after earlier adjustments can be assessed before new modifications are implemented. The earliest any effect of the development of the disease can be assessed is 2 weeks. And only after it's assessed will they then prepare for the next level of reopening. And so each gradual opening takes between 2 and 4 weeks, and it's done in a controlled way. So that at each measure, they are figuring out what's working, what's not working, how to tighten it, how to control it better before they just reopen. So what happened in Israel is that even as we were going into this next wave, the government kept opening and opening and opening and opening, and it didn't seem like there was any control. They still did not have the ability to monitor how people were doing, how businesses were operating. There was just, it was kind of a little bit of tohu vavohu in Hebrew, or a little bit of a balagan. And so basically, as we were watching the cases go from 50 a day to 100 a day and 200 a day, the government said, well, we're going to be very tough and we're going to re-implement everything. And by the way, we're reopening the bars, we're reopening the restaurants, we're going to let people have larger weddings. And they kept reopening as the numbers kept going up. And in Norway, that's not what's happening. So what happens in Norway is they check those numbers, they collect that information, and only after they adjust to where they are and they've implemented things correctly, they're monitoring things correctly, do they then go to the next stage. Now, and this is another principle, the simplest measures are the ones that will stay in place for the longest period of time. That's social distancing, which is easy for them. I told you that's a cultural thing. Staying at home when you're sick, again, they have great social benefits. They get paid when they stay home when they're sick. Practicing good hand hygiene, avoiding contact with your face and hands, avoiding, kissing and hugging, avoiding coughing on other people. We don't shake hands, and sanitizing frequently touched surfaces. So we talked a lot, people who were with this group from the beginning, we talked a lot about frequently touched surfaces. People should be wiping them down, not only in public places, but also in any shared kind of spaces that we have. So that's one of the essential things that they said is going to stay in place for a long time. And there's extra consideration for high-risk people and their caregivers. So remember that even at the beginning of this situation, and it has gotten better, Israel and America and England and other countries found that the resources that were allocated to the elderly were just not there in the correct amounts. They did not get the correct support. And in Norway, they do have a lower number of elderly, but they made it a situation where they prioritized getting them the resources that they needed, and that their risk is recognized as being higher as the restrictions are eased. So there's more caution being taken, more monitoring going on. That's also happening in Israel in institutions of the elderly. So in order to adjust, they have a 5-point scale of how to, actually a 6-point scale of how they adjust and open up their economy. And it has to meet these measurements before they go to the next level. Number one is that the spread of the infection is still under control. We don't have that in Israel right now. But just adequate capacity in the health and care services, okay? So I started talking about that today. And basically, we're starting to see that some of our hospitals are past their capacity, or at least past the threshold of safety. At the international level, we consider 75% capacity at a hospital to be the limit of safety. And when you're past 75%, errors start happening, infections start happening. And Israel, unfortunately, has the most crowded hospital system in the developed world, by far. We are at an average of 96% capacity year round. And in the winter, when there's flu, we are frequently at well over 100% capacity. I'm talking about like 150 to 200% capacity in some hospitals. And that happens almost every year. So that problem means that we have to monitor that very, very carefully. And if we're in June and we're already seeing that we have hospitals that are over 100% capacity in different parts of the country, then we have to realize that these upticks, which have not yet quite gotten to the ICU, they haven't quite gotten to the ventilators, we don't see a huge amount of people dying. Is that going to happen? Probably. Can our hospitals manage it? And the answer is not for much longer, because we're already at that point, and we haven't even started taking into account the coronavirus cases that are coming up. So Israel's not prepared for this adequately because we don't have the number of beds and because we have not taken these measures. The other thing they look at is low risk of infection among people in the high risk group. So, so they want to basically make sure that the numbers of the elderly are not starting to tick up. If they see that, then they have to put more measures in place. So they're monitoring those numbers the same way that we are here. Preventative measures are implemented in the workplace, so they have to make sure that in each industry that opens up, that those measures are being implemented correctly. And dealing with imported infections in Europe, particularly with a normally open border situation, imported infections is a very big problem. Remember that Norway and Sweden, they're right next to each other. And that's a very porous border. Remember, Europe is, you know, a free-for-all. Not right now, but usually. And also, and this is what I thought was mind-blowing, because we definitely don't have this in Israel. The population has confidence. I'm reading from the Norwegian government website. It's a priority before they change and increase the opening up of the economy. The population has confidence in the authorities and understand why the measures can be adjusted. Okay? We didn't get that in Israel. Okay? So this is, again, brilliant. I love how they put this, and this is what's really the key that Israel is missing. A certain degree of fatigue can be expected in populations over time. And there is a perception that the situation is about to change since some measures can be eased, which means that, you know, over a period of time, we have lockdown, we're wearing masks, people start getting fatigue. And fatigue is, you can call it pandemic fatigue. I'm tired of wearing a mask. I'm tired of my kids being home. I just get them out, let them play with their friends. And you hear this in America. We've heard this in Israel. I've heard this in Europe. I've heard it from all over the world, because people are in touch with me from all over the world. And this fatigue is a normal human response. But the way that Norway is dealing with this is they are saying, we're not doing anything until our population understands why we are confident in opening up another sector. So, I mean, when I look at the list of what Israel did, and, you know, we opened this, and 2 days later we opened that, and we haven't even measured how the first thing worked, it basically made people feel very not confident that the government was doing any kind of monitoring. Like, we were desperate to open the economy, but we weren't having the confidence of the people that this was being done in a controlled way. And so what you ended up happening is that this fatigue really kicked in, and people said, you know what, obviously the government feels that everything's fine and that we don't need to do anything, and they stopped following the rules. And that's what led to the second wave. So, and fatigue is a known concept in terms of epidemiology. We know that this happens. So I find it fascinating that this is actually part of their pandemic plan, is building this confidence and making sure that the population has confidence in the authorities. So listen to this. In order to motivate the public to follow the advice that we give, it's important that our communication shows the way forward. We provide hope, we build confidence, we convey knowledge, we provide predictability and create a unified sense of community. Okay, what we have, in my opinion, is a lot of kvetching. Wear the mask, wear the mask, wear the mask, wear the mask. It's very nice, but people who are already fatigued, it goes right over their head. The people who are wearing their mask, we're listening and saying, yeah, they're right. But unfortunately, probably a majority of people are fatigued. And so they're not giving the right message. It has to include all of this. You have to build that confidence with the public for them to do what they need to do. So it's important to continue the local and national monitoring and confidence building in local authorities, in national authorities, in our national figures. One thing I'm really happy about and proud of is that in Israel, when we see our leaders speak, when we see them walking around, they're wearing masks. The people in the media in the room, they are 2 meters apart. So I like the fact that our leaders are showing real leadership and are not just talking the talk, but they're actually walking the walk. And I like that. I think that's a very good thing. I think the fact that that the government makes these videos that are inspirational about handicapped people putting on masks and people who are survivors talking about, you know, how important it is to wear a mask and prevent infection. I think those are all great. What the government has failed to do is to help people understand that the measures, well, they failed in 2 ways. They failed to open up in a controlled way and to measure what they were doing. And then as soon as there's an uptick, to say, we're going to manage that uptick and we're not doing anything else. And the government kept saying they would do that, but did not do that. They kept opening and opening. And that's why we're at hundreds of cases a day, again. But justifying where we are, making sure people feel confident that what they are doing and sacrificing is accomplishing something. Because you are able to do this, we're able to open that. And we are confident because here's the numbers, and here's the regional numbers, and here's the cooperation that we're getting. In Israel, I feel like we're picking up the pieces now. And at this point, it's too late. It's too late to manage this, this particular wave we're in without some drastic measures. And that doesn't mean you have to shut the economy. I think there are ways to do it. And, you know, maybe I'll talk about that in my next video. I hope this has been helpful. I would like to do one more thing, which is I would like to share with you, the logarithmic scale. So this is the logarithmic scale. I've showed this to you before. The nice thing about a logarithmic scale is it really is able to show you trends for larger numbers. So it's able to show you on a larger scale when a trend becomes significant and when a trend does not become significant. So if you take a look over the course of the pandemic, you'll see Israel popping in there. You can see here that this is the trends throughout the days. You can see Israel at this point over here. Israel started doing very well. Our numbers started to drop. And then all of a sudden, we started going back up. When we go up, I don't worry that much. But the fact that we are now turning into a V shape, okay, so when you look at these numbers, the numbers here, logarithmic means that each of these big numbers here is 10 times the previous one. So if you think about a Richter scale, or if you think about a child's growth chart, they usually have these larger growing spaces between the years, the months, or the power of the earthquake. And this side over here is the confirmed cases, also in multiples of 10. So you have 10, 100, 1,000, 10,000, 100,000, a million. So what this means is that, and that's confirmed cases in the last week, okay, because we're looking for trends. So for Israel, what we saw is that when we were all the way down here on May 25th, and I usually use the May 27th as the start of the new uptick, we were only at 91 weekly cases in Israel. Our total amount, so the total confirmed cases only goes in one direction because we don't go to negative, you know, it's a cumulative number. But when the numbers go straight back up, like Switzerland here went up, okay, what this means is that you have more cases, but it's not having a significant impact on the overall caseload. But what happened in Israel is we started veering off. You could see that South Korea is kind of stabilizing. It's not quite the same level of danger as we are. But once you start veering off and you start spreading out, what that means is that the numbers are not only getting higher per week, but you're actually creating a significant bump in the trend, and that you're starting to get back. If you take a look at the trend where Israel is, we don't want to get to this angle. This angle is 2-day doubling time, okay? This means that every couple of days we double our numbers. That's where we get into trouble. Everybody started off here, because remember, you start off with 1 case, and then the next day you have 2 cases, the next day you have 4 cases. So that's pretty early on. Everyone starts off in this area. We are now angling towards getting into exponential growth. That's starting to look like it might happen again. And that's why we have to be careful. So when we look at bumps up, most countries have had bumps up. You can see Germany here is now having some more restrictions because they've had increase of cases, and they haven't quite broken into that angle, but that's what people monitor. We have to monitor that. The United Kingdom started doing very well. They're opening up, and we're going to talk about that today. And you can still see that the United States with the current upsurge, so United States was doing decently, and then the upsurge that they're having now as the economy's opened up, particularly in some of the states that were not as badly hit the first round, they're starting to get bad, and they're back up to basically the worst number, the highest number of new cases per week. Brazil is also doing very poorly. So you can see here that they actually have similar number of weekly cases, but America has more overall confirmed cases. America's passed 2 million. You can see here there's a 2 million, and Brazil's just past 1. So as Israel veers more this way, what we're going to see is that we're going to have an exponential growth in our cases. I hope we can get this under control, but you know, significant changes are going to have to happen, and we don't have any significant evidence that the local closures that are currently being implemented are going to have a big difference or a significant change in the overall population. Because remember that even if you just look at the areas that are being closed, they are a very small percentage at this point of the overall numbers that Israel's seeing. So please stay safe. Please take care of your elderly relatives, neighbors, keep them safe, and wear your mask, and please stay healthy. Take care.